Margaret opened that letter on a Tuesday morning. She had just turned 71, healthy, active, 3 prescriptions, nothing serious. She had been on the same Medicare Advantage plan for 4 years, never missed a payment, never had a claim denied. And now, the letter said her plan was gone. Just like that. No explanation, no apology, just a date, December 31st, and a note that she needed to find something new. She called her friend Carol. Carol said, "Oh, just pick another plan. They're all the same." Margaret almost did that, and if she had, it would have been the most expensive mistake of her retirement. I am Edward. I am a senior policy analyst. I have spent more than 15 years studying Medicare rules, Social Security laws, and the retirement policies that affect seniors just like you. If you are watching this right now, maybe you got a letter like Margaret's. Maybe you heard from a friend that Advantage plans are disappearing. Or maybe you are just trying to stay ahead of a system that seems designed to confuse you. Either way, I want you to take a deep breath. You are not alone. And more importantly, you have rights, legal rights, federal protections that most seniors never hear about. By the end of this video, you will know exactly what those rights are. And I am going to tell you about a hidden mistake, one that nearly 3 million seniors are at risk of making right now, that could lock you out of the best health coverage for the rest of your life. Stay with me. This is important. Let me tell you about Robert. Robert is 67. He retired from the Postal Service 2 years ago. He lives in a small town in Idaho, one of those beautiful places where everybody knows your name. Robert had a Medicare Advantage plan through a regional insurer. $0 premium, dental, vision. He liked it. His doctor was in-network. His 2 heart medications were covered. Everything was fine. Until last October. He got a letter. The same letter Margaret got. His plan was ending. He had until December 7th to pick a new one. Robert panicked. He called a friend. The friend said, "Just go online and pick the cheapest plan. They're all the same." So Robert did. He found another Advantage plan, same insurer, low premium, done in 20 minutes. He thought he was being smart, efficient. But here is what Robert did not know. When your Advantage plan is terminated, when the insurer decides to stop offering it, federal law gives you something called a guaranteed issue right. That means you have the right to buy a Medigap policy, a Medicare supplement plan, and the insurance company cannot deny you, cannot charge you more, cannot make you wait for coverage, even if you have pre-existing conditions, even if you have had cancer, even if you take 12 medications. This is a once-in-a-lifetime window. And Robert walked right past it. He rushed into another Advantage plan. And that window, it closed. Gone. Forever. Now, if Robert ever wants to switch to original Medicare with a Medigap policy, maybe because his new plan's network drops his doctor or his out-of-pocket costs jump to $9,000, he will have to go through medical underwriting. And with his heart condition, he will likely be denied or charged 3 times the normal premium. That is the trap. And Robert is not alone. According to the Kaiser Family Foundation, 2.6 million seniors had their Medicare Advantage plans terminated at the end of 2025. That is 13% of everyone in an individual Advantage plan, double the number from the year before. All right, let me walk you through what the official rules actually say. No rumors, no opinions, just the facts, straight from the government agencies that make these rules. First, how big is this? The Kaiser Family Foundation, a nonpartisan health policy research organization, reports that approximately 2.6 million Medicare beneficiaries had their Medicare Advantage plans terminated at the end of 2025. That is 13% of everyone in an individual Advantage plan with drug coverage. Compare that to the year before, only 6%. This is more than double the disruption, and it hit some states especially hard. In Vermont, 93% of Medicare Advantage enrollees were in a plan that was terminated. Wyoming, 65%. South Dakota 64%, Idaho 63%, New Hampshire 61%, North Dakota 60%. If you live in a rural area, you were hit harder than anyone. Nearly 1 in 4 people who lost their plan lived in a rural county. Rural seniors were disproportionately affected, and in some areas, particularly Vermont, more than 2/3 of affected enrollees were left with absolutely zero Medicare Advantage options to choose from. Now, here is your legal protection. When your Medicare Advantage plan's contract is not renewed, meaning the plan simply stops being offered, you are granted a special enrollment period. Per the Centers for Medicare and Medicaid Services, this period runs from December 8 through the last day of February. During that time, you can do one of two things. Option 1, pick a new Medicare Advantage plan. Option 2, go back to original Medicare. And if you do that, here comes the part most people never hear about. You have a guaranteed issue right to buy a Medigap policy. The official Medicare guide, Choosing a Medigap Policy, CMS Product Number 021, says it clearly on page 17. If your plan is leaving Medicare, you have the right to buy Medigap Plan A, B, D, or G. And here is what guaranteed issue means. This is critical, so please listen carefully. Number 1, the insurance company must sell you a policy. They cannot say no. Number 2, they must cover all your pre-existing health conditions. No waiting period. Not 6 months. Not 1 month. Coverage starts immediately. Number 3, they cannot charge you a higher premium because of your health history. Diabetes? Covered. Heart disease? Covered. Cancer history? Covered. This is federal law. This is your right. The Kaiser Family Foundation confirms this explicitly. They state, and I quote, "Beneficiaries who have had their coverage terminated by their Medicare Advantage insurer have a special guaranteed issue period to purchase a Medigap policy, meaning they cannot be denied coverage or charged a higher premium for a Medigap policy due to pre-existing conditions, something Medigap insurers are permitted to do in most states in most other cases outside of a person's initial eligibility period for Medigap." That last part, about what insurers are permitted to do outside this window, that is the entire reason this moment matters so much. But here is the catch, the timeline. You must apply for the Medigap policy no more than 63 days after your Advantage plan ends. Your plan ends December 31st. So your deadline is approximately the first week of March. If you miss that window, you lose the guaranteed issue right. And after that, in most states, Medigap insurers can ask about your health. They can deny you. They can charge you double or triple. That is not my opinion. That is on page 11 of the official Medigap guide from Medicare. And here is something else Medicare.gov tells us directly. If your plan's contract is not renewed and you do not pick a new Advantage plan, you will be automatically enrolled back into original Medicare. That is the safety net. But that is only half the protection. You still need to actively purchase the Medigap policy. Original Medicare alone has no cap on out-of-pocket costs. A serious illness without a Medigap policy could mean tens of thousands of dollars in medical bills. That is why the Medigap decision is so critical. And one more thing your plan is required by law to do. Per CMS guidance, Section 60.1.8, your Medicare Advantage plan must notify you of your Medigap guaranteed issue rights when you disenroll. The official model notice for this is called Exhibit 24, Model Notice for Medigap Rights per Special Election Period. But here is the reality check. These notices go out in dense legal language, buried in stacks of paperwork. Many seniors miss them entirely. That is exactly why I am making this video. Let me give you 3 exact steps. Write these down. Pause the video if you need to. Step 1. Check your mail. Now. Every fall, usually September or October, your Medicare Advantage plan sends you something called the Annual Notice of Change, or NOC. If your plan is ending, you will receive a non-renewal notice. Do not throw this away. Read it carefully. Look for the words, "Your plan will not be offered next year." If you see those words, you are in the window. Step 2. Call SHIP before you choose anything. SHIP stands for the State Health Insurance Assistance Program. This is a free, government-funded counseling service available in every state. They are not selling anything. They do not work for insurance companies. They will help you understand your options, including whether switching to Original Medicare with a Medigap policy is the right move for your specific situation. Visit shiphelp.org. That is shiphelp.org to find the number for your local SHIP office. Call them before you enroll in anything. Step 3. If you choose Medigap, do not delay. Remember, you have 63 days from when your Advantage plan ends to exercise your guaranteed issue right. That means early March at the latest. Do not wait until February. The earlier you apply, the more choices you have, and the smoother the transition. And one more thing, do not forget Part D. Medigap does not cover prescription drugs. You will need a separate Part D drug plan. If you go more than 63 days without creditable drug coverage, you will pay a permanent late enrollment penalty added to your Part D premium for the rest of your life. Use the Medicare Plan Finder at medicare.gov/plan-compare to compare both Medigap and Part D plans in your area. And if a Medigap insurer ever tries to deny you during your guaranteed issue window, know this: you can file a complaint with your state insurance department. Visit content.naic.org to find yours. This is your legal right, and it is enforceable. Look, I have been doing this work for a long time, and I will tell you something I have learned. The rules change every year. The notices get more confusing, the deadlines get tighter, and the insurance companies, they are not going to sit you down and explain your rights. They are counting on you not knowing. That is why I built something for you. Below this video, in the description, there is a link to join the Global Senior Alerts Official WhatsApp channel. When you join, you will get real-time alerts straight to your phone about Social Security changes, Medicare rules, bank policies that affect seniors, insurance deadlines, and travel regulations. No spam, no ads, just the facts you need to protect yourself. And when you join, you can download a free guide, the Senior Benefits Protection Guide, that summarizes everything I talked about today, plus additional protections most retirees never hear about. I do not want you to rely on YouTube notifications for this information. YouTube algorithms change, videos get buried, but a WhatsApp message that goes straight to you. If this video helped you, if Robert's story sounded familiar, share it with one person, your neighbor, your sibling, someone at church, because the difference between knowing your rights and missing that window could be tens of thousands of dollars and your peace of mind. I am Edward. Thank you for watching. And please, click that link in the description and join us. I will see you in the next alert.